Hello, and thank you for joining us. My name is Randall Gay, and we're here for another episode of McGovern Medical Minutes. Last time we talked about social media and the effects on the mind in our lives. This time we're going to talk about something that has definitely affected all of us, and that's COVID-19. And I'm here today with the Chief of Infectious Diseases here at McGovern Medical School, Dr. Ostrosky. Dr. Ostrosky, thanks so much for joining us.
My pleasure.
All right, so we talk a lot about relying on trusted sources to guide us through this pandemic in these really difficult times. So why don't you tell our viewers why you are a trusted source and what you do in the field?
Thank you very much. So we're very careful in reviewing the latest scientific literature directly from the source. So we don't really go by press releases or what we find in the sort of social media or lay press. We actually read the articles that are being produced out there, analyze information from a scientific standpoint, and we try to put out the best information out there for our community.
Great. So last time we talked to you, we actually talked about myths around the COVID-19 vaccines, Pfizer, Moderna, Johnson & Johnson, and so forth. So since then, how has the vaccine rollout gone, and where do you see it going from here?
So these vaccines have been given to billions of people worldwide, and they're very efficacious. The failure rate of these vaccines is 1 in 10,000 people that get them will have a breakthrough case that lands them in the hospital or actually die from it. So dramatic efficacy. And aside of safety, we have seen occasional rare side effects with Johnson & Johnson, some neurological complications, some clotting issues, very rare. And with the mRNA vaccines, the Pfizer and Moderna vaccines, we have seen some heart inflammation, particularly in young people. But again, this is very rare and much less frequent than those same side effects if you happen to get COVID-19.
Right. So you talked about breakthrough cases. Obviously, we have had hundreds of millions vaccinated just here in the United States, and yet we just had one of our biggest COVID waves here in the Houston area. So what leads to that? Is it vaccine hesitancy? Is it breakthrough cases? Is it this variant? What did we just get through here?
So this was kind of the perfect storm. We have a strain that is more transmissible. Delta is an order of magnitude more transmissible than the original strain and the UK strain that we had seen. And we also sort of got tired of the mask, and for a little bit, CDC was saying it was okay to take off the mask if you were vaccinated. And we started to travel, and we started to do sporting events and big concerts and anime conventions, etc. So this converged into a new wave for the United States. So again, a more infectious virus, taking off the mitigation measures, and not high vaccine penetration as we would have wanted to have.
So what would you say to somebody that says, oh, look at this wave, there's no point in getting the vaccine because it's going to happen to me anyway?
Absolutely wrong. We know that the vaccine will prevent severe complications, will prevent hospitalizations, and will still protect you against getting disease, even mild cases or asymptomatic disease. It's not perfect. We do see some mild breakthrough cases, but you are assuring yourself you're not going to land in the hospital and you're not going to die from COVID if you get the vaccine.
Speaking of variants, where are we with these variants, or can we expect more of them? Should we be worried? And how are we now that we're kind of leaving that wave, at least here in the Houston area?
Yeah, so again, at this point, Delta is accounting for about 99% of the variants in circulation here in Houston and worldwide. It is the dominant variant. There's a few other variants that we're looking at, carefully watching, primarily out of South Africa and Latin America, that have not taken hold. They're not transmitting effectively. Variants of concern, we call them, but not of concern right now.
Okay. What happens when, so we know, you talked about what happens when a curve starts going up again, and we have what we refer to as a wave. What has happened to reduce the number of cases? What causes that curve to then go down?
So eventually, when we have an increase in cases, people start getting more concerned about it. We go back to masking, we increase vaccination rates, we go to a certain degree of mitigation in the workplace again, and unfortunately people do get infected and create a little bit of a herd immunity there. So again, it's a convergence of vaccination, mitigation, and awareness that drives the waves down.
So we've seen amongst all of the sort of misinformation around COVID-19, we've seen a rise in some either at-home remedies or over-the-counter remedies that weren't intended to be to treat COVID-19. So what would you say to somebody considering taking one of those, such as ivermectin or something else?
Yeah, there's a lot of misinformation out there, very professional looking. I was looking at some websites the other day that appear to be legitimate. They're made by people with scientific credentials, MIT, things like that, and they just are full of untruthful statements, full of misinformation, full of flawed scientific logic, and the ultimate product of that is people are dying, because when you get bad information and you make bad choices for treatment, you're delaying the appropriate treatments and the treatments that are known to be life-saving, and you're going to end up with a bad outcome. So again, there's a lot of information out there. Try to go with mainstream media, mainstream scientific organizations. Everything you're reading in the fringes is really flawed, and the problem we're having again for trying ivermectin or chloroquine or zinc or vitamin C is that it delays accessing the appropriate care. There's very good treatments that we're giving outpatient now, monoclonal antibodies. There's very good treatments in the hospital when you get there early. If you delay the care and the disease progresses, there's very little we can do at the end of that course. So again, the big problem with misinformation is that it delays appropriate care for the patients.
Great. So if someone has a breakthrough case or is maybe someone in a group that is not able to get vaccinated, whether it's their age or what have you, and they do end up with COVID-19, what would you recommend that they do to make sure that they don't get any more sick?
Talk to your doctor. Again, the cornerstone on outpatient treatment right now is this monoclonal antibodies. These are engineered antibodies that you get an infusion of or some injections, and they go and neutralize the virus. So totally neutralize it, and it doesn't progress into the inflammation and the organ damage that we see with this disease. So don't delay care. Don't spend your time reading the internet. Go and see your doctor and try to access monoclonal antibodies.
So we talked about some remedies that you should not be trying, but in addition to the vaccine, we now hear about this pill from Merck that may be on the horizon. I know they're still at this point applying for authorization, but what is this, and how could it potentially change the game for COVID treatment?
So we heard about a press release on this new drug called Moldova. That is kind of a medication that inhibits viral sort of genetic material synthesis, and it showed very dramatic results in avoiding hospitalizations and preventing deaths. So much so that they stopped the study because they didn't think it was ethical to continue putting people on placebo. And that's, again, science at work, right? So this is a potential game changer, because the moment we have an outpatient treatment that doesn't require, getting infusions or getting into the hospital to get IV medication or steroids, etc., that's when this becomes a manageable infection in the community. And pretty much like we do with the flu, you would get diagnosed, you get Tamiflu or other flu medication, you get diagnosed with COVID, and you would get these pills that would, again, prevent you from getting sicker and landing in the hospital. We are going to call it a game changer. This steers the pandemic in another direction, and this is one of several outpatient treatments that's being developed right now.
So a lot of people have already received booster shots for, I believe, the Pfizer vaccine. Is that correct? Why do some people need booster shots and not others? Why are we only giving them to a certain age group at this time?
Very good. So FDA has reviewed the information that Pfizer provided for booster shots, and they saw a very clear effect in boosting the immunity in people over 60 years of age, people with comorbidities, and there's also some data looking at people with very high occupational exposures, like frontline workers, healthcare workers, etc. So looking at that data, the FDA approved it initially for that segment of the population. We're getting more information out of Israel for the general population, showing very good results, and it's just a procedure. It's a way, FDA approves for what it receives data for, right? So this was the first data set that they reviewed, approved for that indication, and there's going to be more data coming for Moderna, for Johnson & Johnson, and then for all of them for the general population. So I do expect that before the end of the year, we're going to be giving boosters to basically the whole population.
I've heard rumors that the Moderna shot has a longer lasting protection from the virus, and that's why we're not getting booster shots for that. How accurate is that?
Indeed, Moderna has a little bit higher antibody levels than Pfizer would, and they appear to be lasting a bit longer as well. But that's not to say that boosters are not going to be needed for Moderna.
So I know that there's been some talk recently about pregnancy and vaccines and the virus itself. I know information coming from the CDC. So if you're pregnant thinking about getting pregnant, what should you know?
Very important question. So initially, CDC, FDA, and some of the societies, medical societies, were cautiously recommending vaccines for pregnant women or women who were breastfeeding. But since then, we've had a lot more experience with pregnancy. There's a large study that was released that showed that there was no effect in safety outcomes in pregnancy, that is miscarriages or stillbirths or any other obstetrical or fetal complications. And in the other side of this, we see that pregnant women have particularly severe cases of COVID-19. So the language has changed. We're now strongly recommending pregnant women and women who are breastfeeding to get the vaccine. Very important safety sort of maneuver.
Yeah, I can tell you last year around April was when my son was born, and it was right when the pandemic was really coming into full force here in the United States, and that's why I was so nervous all the time, was we didn't know how it would potentially affect my wife, and the initial data was saying that it doesn't affect women any differently. So I suppose that there's been data now that there's been so many more cases since then that would suggest otherwise.
Yeah, recent data has shown that pregnant women have particularly severe cases of COVID. It's just heartbreaking to see somebody who's pregnant landing in the ICU, intubated, having to do emergency C-sections when this can all be avoided safely with a vaccine.
So where are we right now? Are we still pushing getting vaccines? Are we back to wearing masks regularly? How long is that going to last?
That's $1 million question. So I do think that we need to get a larger proportion of the population vaccinated. We need to continue wearing masks for a little bit longer. We need to make testing even more accessible for people. That will allow us to get better public health action in contact tracing and isolation. And when the oral drugs or inhaled drugs are approved, that'll be the convergence of factors that we need to really get COVID-19 behind us.
Can you tell me about what is herd immunity? And I believe when we first talked about it, over a year ago, it was kind of in a different way where we were talking about, just let everyone get the virus and then we'll have herd immunity.
Right.
So now we're talking about trying to get to herd immunity through vaccinations. So what does it mean, and why is it something that we're striving for at this point?
Herd immunity is a public health concept where you have enough people in the community who are immune to a disease, either through natural infection or vaccination, where further transmission of the virus is difficult. So the virus is not finding susceptible hosts and it just goes away, basically, right? And we typically had been talking about herd immunity when about 60 to 70% of the population either had the disease or was vaccinated. But with the more infectious Delta variant, we're actually talking about 80 to 90% of people having to be there. So we're nowhere there.
Do you have any hope of getting there?
Yeah, I mean, again, my hope is that we get there through vaccination. Unfortunately, we're making headway in natural infection as well with these big waves. But the convergence of those two things are probably going to get us to herd immunity. But again, getting there through natural infection is very dangerous because people die when they get COVID, and we're going to lose a lot of people if we rely on that.
I wanted to ask you about vaccine hesitancy. We know that a lot of it comes from misinformation online, but there's a lot of, at least a little bit more understandable hesitancy, especially within minority populations that have just always had some kind of mistrust for healthcare based on sort of generational issues. So what can you tell people that have those kind of hesitancies? Maybe not someone that is, refusing to ever get the vaccine, but just isn't necessarily trusting of someone else putting something in their body.
Right, so hesitancy is very, very complex. We don't assume that it's all misinformation and it's all sort of conspiracy theories, etc. There is some reason to be sort of cautious when this is a new vaccine, and it may not have been studied in people with your own conditions or your own situation, etc. But at this point, the vaccine has been given to over 5 billion people worldwide, and we've had over a year experience with it currently. There's no long-term side effects. There's very well-known minor sort of side effects that happen around the vaccination point. And just find somebody to talk to that has been vaccinated or that knows something about it. Talk to your doctor, talk to your pastor, your employer. Vaccines are very important. It's our number one way to get out of this pandemic, and there's going to be more vaccine mandates around from the federal government, and it's just going to be very difficult to function eventually if you're not vaccinated.
Well, Dr. Ostrosky, thank you so much for joining us. I know this is a really important topic to you and to the rest of us as well, so thank you again.
Thanks.